Walking can positively affect your general well-being, from improving your blood pressure to maintaining your mental health as well. It seems like more people than ever are hitting the pavement during this pandemic, right? I see a lot of people out and about. They're wearing their masks right now. They're also developing foot problems because they're doing a lot more walking. One New York doctor standing by to help us right now.
Hello, everyone. Good morning. So obviously, during these difficult times, it's important that we do maintain cardiovascular health and try to walk as much as possible. But it's also important to not neglect your feet. And just because we're at home, not hitting the pavement, going to and from work, you can still take advantage of telemedicine. It's a convenient way to connect with a doctor to get immediate relief of your symptoms. It's convenient, it's simple, and helps us all maintain social distancing. So it's definitely the new normal and something that I think is going to be around for the future. So I definitely think people should be taking advantage of it.
So I want to properly introduce you. I'm sorry, Dr. Miguel Cunha from Gotham Foot Care in Manhattan. You obviously, I remember you from a piece with Marisol Castro. She was supposed to be doing this interview, but you actually helped her pick out the best shoes right there. So how do you really treat people's foot issues through the screen right now, right? A lot of telemedicine happening, a lot of people turning virtually to their doctors. Are they really lifting their foot to the camera? How does this work?
In some cases, yes. So obviously there's some limitations with doing a consultation over the video rather than doing it in person. In person, my assessment, my evaluation is going to be more objective. I could put the patient through a range of motion, determine their source of pain, the level of pain. I could touch their foot. Whereas on a video call, I'm depending completely on their subjective description of their symptoms. So there are some limitations, but what I've been doing to facilitate this process, I will actually mimic the physical exam on my foot. I have them go through a certain range of motion so I can specifically find out exactly where their source of pain is, and it helps me get a better idea of whether it's nerve, tendon, ligament, bone. So that's the first thing I'll do. I'll actually throw my foot up in front of the camera. I'll have them do the same. The second thing that I do is I have them take notes so that they could get a better description or get a full comprehension of all the advice that I'm giving them so that they could absorb the information and hold on to it after our call. So yeah, we try to work around it.
So with people right now, they're walking more so than they normally would, right? If they, just to get around and get some fresh air right now. What is your advice to them? What has been your most popular type of call that's coming your way right now?
Definitely arch pain, heel pain, which they're both plantar fasciitis, Achilles tendonitis, neuroma pain, bunions, hammer toes. And then some people will call in with dermatological issues such as athlete's foot or nail issues.
Do you find that some people, they might be hesitant to call for telemedicine? They don't feel it's secure enough right now? I mean, what is your advice to those people who are a little hesitant, no matter what their issue, whether it's foot pain or any other health issue right now? What are you telling people?
Well, a couple things. One, the video conference calls are under a HIPAA-compliant platform. So some people are concerned about recordings and things like that. So one, it's HIPAA-compliant. Two, it's simple. It's easy. You shouldn't delay or neglect getting immediate foot attention to, if you have pain, you shouldn't be dealing with it. It's simple, it's convenient, it's safe, and especially at a time like this current crisis where you can't get to the doctor. It helps us all maintain social distancing. So there's no reason to hesitate.
All right. Good advice there, Dr. Cunha. I do appreciate it. And thank you for your time this morning. I really do appreciate it. Okay. Sorry you didn't get to talk to Marisol. You were stuck with me this morning. Stay safe to you. Okay, my friend.